Chapter 10, Describing and Communicating the Learning Outcomes and Competencies. Different frameworks or models can be used to categorize and communicate learning outcomes. Learning frameworks. Statements of learning outcomes and competencies are usually structured around a number of domains, usually no more than 12. Each domain represents a category of learning outcomes, for example, clinical skills. Learning outcomes are then specified in more detail for each of the domains. A number of frameworks or models for grouping learning outcomes have been described. Not surprisingly, the different frameworks, while having significant differences, have much in common with significant overlap between the competencies specified. Some of the most widely used frameworks are described below. Criteria for a learning outcome framework. A learning outcome framework should meet the following criteria. The key domains identified should reflect the vision and mission of the institution as perceived by various stakeholders, including the public. They should reflect clearly, with an appropriate sense of values, what is expected of a doctor. The domains should be defined at an appropriate level of generality. The number of domains should be small enough to be manageable, but large enough to distinguish different aspects of competence. The framework should provide a holistic and integrated view of medical practice and indicate the relationship between the different outcome domains. The framework should assist with the development of enabling outcomes for each of the key domains specified. The framework should be clear and unambiguous. It should be intuitive and easy to use. The Dundee three-circle outcome model and the Scottish Doctor framework. This framework is based on 12 domains which are incorporated in a three-circle model. It differs from other frameworks as it emphasizes the relationship between the different domains and shows how the different aspects of patient care do not function in isolation. The technical aspect of a doctor's performance cannot be seen in isolation. The aim for a doctor is to successfully integrate all the competencies. We have looked in Chapter 7 at a similar model for describing a good teacher. Figure 10.1, the three-circle model for learning outcomes incorporating 12 domains. Performance of tasks. What a doctor is able to do doing the right thing. 1. Competence in clinical skills. 2. Competence in practical procedures. 3. Competence in investigating a patient. 4. Competence in patient management. 5. Competence in health promotion and disease prevention. 6. Competence in communication. 7. Competence in handling and retrieval of information. Approach to tasks, how the doctor approaches their practice doing the thing right. 8. With understanding of basic clinical and social sciences and underlying principles. 9. With appropriate attitudes, ethical stance and legal responsibilities. 10. With appropriate decision making, clinical reasoning and judgment. Professionalism. The doctor as a professional, the right person doing it. 11. An understanding of the doctor's role in the health service. 12. An aptitude for personal development and a demonstration of appropriate transferable skills. The inner circle represents the technical skills of the doctor or what the doctor is able to do doing the right thing. It includes 7 domains. 1. Clinical skills. 2. Practical procedures. 3. Patient investigations. 4. Patient management. 5. Health promotion and disease prevention. 6. Communication. 7. Information handling skills. The middle circle represents the way the doctor approaches tasks in the inner circle, doing the thing right. 8. Understanding of social, basic and clinical sciences. 9. Appropriate attitudes and ethical understanding. 10. Decision-making skills and clinical judgment. The outer circle represents the development of the personal attributes of the individual, the right person doing it. 11. The role of the doctor. 12. Personal development. This model is described in more detail in Appendix 2. The three-circle model with the 12 outcome domains has been adopted in the Scottish Doctor as a description of the abilities of medical graduates from the 5 Scottish medical schools. The approach has also been used in other countries. The Callum's Physician Competency Framework. The Royal College of Physicians and Surgeons of Canada developed a framework built around 7 physician roles. First introduced in 1996, this was revised in 2005 and again in 2015. The framework makes explicit the abilities of the highly skilled physician. The roles are 1. Medical expert applying knowledge, skills, and attitudes to patient care. 2. Communicator communicating effectively with patients, families, colleagues, and other professionals. 3. Collaborator working effectively within a healthcare team. 4. Health advocate advancing the health and well-being of patients and populations. 5. Leader participating effectively in the organization of the healthcare system. 6. Scholar committing to reflective learning as well as to the creation, dissemination, and application of medical knowledge. 7. Professional committing to ethical practice and high personal standard of behavior. Figure 10.2 illustrates the elements and the interconnections of the roles. The Canon's competency framework has been used in postgraduate and continuing education in Canada and worldwide and has also been adopted for use in undergraduate education. The Accreditation Council for Graduate Medical Education. The Accreditation Council for Graduate Medical Education in the United States developed a model based on 6 competency domains and 36 competencies closely aligned with healthcare quality aims. The competency domains are Figure 10.2, the Canon's physician competency diagram with medical expert, collaborator, leader, health advocate, scholar, professional, communicator. One, patient care, what you do. 2, medical knowledge, what you know. 3, professionalism, how you act. 4, interpersonal and communication skills, how you interact with others. 5, practice-based learning and improvement, how you get better. 6, system-based practice, how you work within the system. The ACGME competencies are used both internationally and in U.S. postgraduate medical education programs to foster and assess resident physicians' development in the 6 domains. They have been adopted for the maintenance of certification program in the United States and are also used in undergraduate education. The Brown abilities. Brown University in the United States was one of the first medical schools to adopt an outcome-based approach to education based on a series of 9 abilities. The Brown description of learning outcomes is of interest in that it describes for each of the 9 abilities observable behaviors that students must demonstrate at beginning, intermediate, and advanced levels of their training. The 9 abilities identified to describe a successful doctor are 1. Effective communication. 2. Basic clinical skills. 3. Using basic science in the practice of medicine. 4. Diagnosis, prevention, and treatment. 5. Lifelong learning. 6. Professionalism. 7. Community health promotion and advocacy. 8. Moral reasoning and clinical ethics. 9. Clinical decision making. Global minimum essential requirements. The Institute for International Medical Education of the China Medical Board in New York, working with an international network of experts in medical education, developed as a set of learning outcomes the global minimum essential requirements. What is of particular significance is that they were designed from the outset around the competencies expected of graduates from medical schools in countries throughout the world. The 7 domains are 1. professional values, attitudes, behavior, and ethics. 2. Scientific foundation of medicine. 3. Clinical skills. 4. Communication skills. 5. Population health and health systems. 6. Management of information. 7. Critical thinking and research. General Medical Council UK. The UK General Medical Council set out the expected outcomes for graduates from the UK medical schools in three domains. 1. The doctor as a scholar and a scientist. Apply medical scientific principles to medical practice. Apply psychological principles to medical practice. Apply social science principles to medical practice. Apply to medical practice the principles, method, and knowledge of population health and the improvement of health and healthcare. Apply scientific method and approaches to medical research. 2. The doctor as a practitioner. Be able to carry out a consultation with a patient. Diagnose and manage clinical presentations. Communicate effectively with patients and colleagues in a medical context. Provide immediate care in medical emergencies. Prescribe drugs safely, effectively, and economically. Carry out practical procedures safely and effectively. Use information effectively in a medical context. 3. The doctor as a professional. Be able to behave according to ethical and legal principles. Reflect, learn, and teach others. Learn and work effectively within a multi-professional team. Protect patients and improve care.